Polycystic ovarian syndrome is a condition in which the ovaries produce an abnormal amount of androgen, a male sex hormone, that are usually in small amounts. Ovulatory disorder classified as menstrual disorder such as oligo-ovulation is infrequent or irregular ovulation having a cycle greater than 38 weeks or having less 8 cycle in a year. Anovulation is the absence of ovulation in a normal cycle. Manifest itself as irregular menstrual period or bleeding. Can also cause cessation of period or excessive bleeding. Polycystic ovary present of numerous small cysts in the ovary. What causes polycystic ovarian syndrome? Hormonal imbalance. Men and women produces sex hormones in different amount. In women, the ovaries makes the hormone estrogen, progesterone and also androgen such as testosterone. The adrenal gland also makes androgen. These glands seen on the top of the kidney. These hormone regulates women menstrual cycle and ovulation when the egg is released. Androgen are often called male hormone but female body makes them. In female with polycystic ovarian syndrome, the body makes higher than the normal amount of androgen. The body makes too much of insulin, signaling the ovaries to release extra male hormone. The higher amount of androgen in women with polycystic ovarian syndrome can interfere with egg development and release. Instead of egg maturing, sometimes cyst, a small filled sac develop. Genetic component is inherited. It is possible that 50% has a chance to inherit the predisposing variant from the parents. Polycystic ovarian syndrome may be related or worsened by exposure during prenatal, epigenetic factor, environmental impact to certain drugs and increasing rate of obesity. The polycystic ovaries develop when the ovaries are stimulated to produce excessive amount of androgenic hormones such as testosterone by either one or in combination. The release of excessive luteinizing hormone by the pituitary gland through high level of insulin in the blood in women whose ovaries is sensitive to the stimulus. Majority of women with polycystic ovarian syndrome or insulin resistance common among in normal weight women. Adipose tissue possess aromatase, an enzyme that convert androstenedione to esterone and testosterone to estradiol. The excess of adipose tissue in obese women create paradox of having both excess androgen, which is responsible for hirsutism or acne, virilization or masculinization, and excess estrogen. Polycystic ovarian syndrome is common sign on ultrasound examination of multiple or polyovarian cyst. These cysts are immature ovarian follicles. The follicles have developed from primordial follicles, but this development has stopped at an early stage due to the disturbed ovarian function. It may appear as string pearl upon ultrasound. Polycystic ovarian syndrome associated with chronic inflammation correlate inflammatory mediator with anovulation and other polycystic ovarian syndrome symptoms. Not everyone with polycystic ovarian syndrome has polycystic ovaries, nor does everyone with ovarian cyst has polycystic ovarian syndrome. Primary treatment for polycystic ovarian syndrome. 1. Lifestyle changes. 2. Use of medicine. The goal of treatment are in 4 categories. 1. Lowering of insulin resistance. 2. Restoration of fertility. 3. Treatment of hirsutism or acne. 4. Restoration of regular menstruation and prevention of endometrial hyperplasia as a condition of excessive proliferation of cell of the endometrium and endometrial cancer. Endometrial hyperplasia result from high level of estrogen combined with insufficient amount of progesterone-like hormone, which ordinarily counteract estrogen proliferative effect on the cell. Endometrial hyperplasia one of significant risk factor for the development of endometrial cancer, so careful monitoring and treatment for this disorder. Please view, like and subscribe. Thank you.